certain bacterial infections, really, like your gonorrhea, your chlamydial infections. These are the two that are the most prevalent. I mean, as far as gonorrhea and chlamydia in our state, the state of Louisiana has always been almost number one, maybe number two in highest ranking for those two STDs. So these are really simple to get rid of. I mean, very, very simple. Short antibiotic course for both, and it clears the infection. But if you don't, get seen for these infections, it can really have some detrimental effects to a woman's health, including, pelvic inflammatory disease, just chronic pelvic pain. Women can become infertile from this. There's a lot of things a lot of sequelae of events that could happen if you don't get treated for these things. So things to look out for are just any kind of profuse discharge, anything that smells or looks abnormal to you. You've been living with your body for your whole life, so you're pretty much aware of what is the status quo. So if you notice something that is abnormal, any type of skin lesion, any type of lump or bump, especially if that lump or bump is super painful or bleeding or has any kind of drainage coming out of it. These are all things to look out for. And it's also things that you want to look out for in your partner as well. Never be embarrassed to talk about those things. If you notice something on your partner, it's of course like that's your health. It's your obligation for your own sake to ask about those things. How long has that been there? And know those things about yourself as well. Like, how long has that been there? Is this new? Does it itch? All of these things are important to just monitor. And then of course there's, so those are the two main bacterial infections, but there's also syphilis. So the first thing to look out for syphilis is almost like a circular, non-painful little lesion somewhere. And some people get tripped up by this because they always suspect these things to be on the genitals, but this can show up on the mouth. It can show up on around the anus. Like it can just come up in different areas. It doesn't just have to be on the vagina. It doesn't have to just be on the penis. So those are also things to look out for. With the syphilis, it's non-painful versus something like herpes. Herpes tends to be really painful for people. People that have the mouth sores or the genital sores. People typically who have chronic infections with herpes, they know that their inflammation or the infection is about to show up. They know their little lesions are coming because the nerve, it becomes really sensitive and you can kind of feel these sharp pains. So those are also things to look out for. And especially with the herpes, feel in your groin area. You can feel if you have swollen lymph nodes, and that will typically be painful as well.